Hello and welcome to all the Physio TV viewers. I'm Dr. Ria from Sancheti College of Physiotherapy. Today we have with us Dr. Shruti Mankar ma'am, Assistant Professor, PES Modern College of Physiotherapy. Ma'am has pursued UG and PG education from TN Medical College, Mumbai. Ma'am is also gold medalist for MPT cardiovascular and respiratory physiotherapy. Ma'am has done research work in hypertension, sleep quality, OAD, and various other respiratory conditions, and has also secured first and second prizes for paper presentation at national and international platforms. Ma'am, we are delighted to have you here and look forward to the talk. Over to you, ma'am. Thank you.
So let us walk through breathing first, a short revision of what breathing is. Okay,
Okay.
is my screen seen?
Yes, ma'am, I can see.
Okay. So our lungs, they are very carefully placed in the thoracic rib cage. Along with the thoracic rib cage, they are being helped by two important muscles, the intercostals and the diaphragm. We know that when these intercostals and the diaphragm, when they contract, the diaphragm flattens and the intercostal muscles also expand. So the thoracic volume increases, okay, and the interthoracic pressure decreases. Thus, the air that we breathe flows from high to low. That is, the air breathes in and does the process of inhalation. Whereas when the diaphragm goes back to its original position and the intercostals shrink in, the interthoracic pressure increases, is high, and the air flows out, thus initiating the process of exhalation. Now, like any other muscle in the body, our diaphragm and intercostal also have to have a neural control. Some neural center in the brain, which is responsible for sending impulses from the brain to the muscles in order for these muscles to contract. Okay, and that here I'm going to introduce the neural control of respiration. So, if you can see here in the image, the highlighted part is your pons and the medulla. Now, there are a group of muscles located in the medulla oblongata known as the dorsal respiratory root neurons. Okay? These neurons send impulses to the intercostals and the diaphragm via the cervical, thoracic, and the phrenic nerve. We know that the phrenic nerve is the one that innervates your diaphragm. So when this DRG, the dorsal respiratory group neurons, send impulses to these intercostals and the diaphragm contracts, the intercostals contract. See, the diaphragm has contracted, that is, it's flattened up, the intercostals have expanded, the chest cavity volume has increased, hence the process of inhalation. Okay. So basically, this DRG is responsible for initiating the inhalation and hence is also called as the inhalation center. Now, till when are these muscles going to get contract? They need to inhibit at some point of time. Otherwise, there has to be an initiation for exhalation. So that is done by a separate group of neurons located in the pons. Okay, the pneumotaxic center. It is also called as the inspiratory off switch because it is literally a switch that switches off these impulses from the DRG to the intercostals and diaphragm. If you can see in the image, the impulses going from the DRG to the intercostals have stopped. This means when the impulses are stopped, the diaphragm is going to go back to its resting position. That is, it is going to expand further upwards. And the thoracic cage is going to shrink. The volume is going to decrease. The pressure is high, and thus exhalation is going to start. So this switch of DRG to pneumotaxic center is nothing but your inhalation and the exhalation. Okay. Now this pneumotaxic center is so beautifully trained that it does not switch off for more than 3 to 5 seconds. Okay. it will not switch off the impulses for more than 3 to 5 seconds. And in a minute, it switches off for approximately 12 to 16 times, which means that the respiratory rate, which we say is 12 to 16 or 16 to 20, is set with the help of this pneumotaxic center. So you will realize that this pneumotaxic center is just not taking care of the rate, but also the depth. So in the image of the graph, this is because of inhalation and the exhalation. The contraction, the impulses being sent to the diaphragm, intercostals, muscles getting contracted, inhibited by the pneumotaxic center, and the exhalation. Okay, so this was about the normal neural control of respiration, involuntary one. Okay, the voluntary one, I am not going into the details. The voluntary control is located in the cerebral cortex, and there is far more, but I'll restrict myself to involuntary control of respiration. This was about the normal control of respiration. Now, let us have a situation. When we see a person is exercising, maybe cycling, maybe walking, running, whenever a person is exercising or whenever the particular muscles are exercising, we have observed that the person's respiratory rate increases, right? It is the your body's common. We've seen when a person exercises, you see him, his heart rate is high, maybe his respiratory rate is high, he is sweating, perspiring more. Probably he is not so comfortable after a particular time. So because he's taxed much. So we have seen this response after exercise. What happens when a muscle exercises or when a muscle does performs a physical activity? The muscle is in need of more and more of oxygen. Okay, and carbon dioxide is expelled from the muscle. We know that the muscles are in more and more need of oxygen. And the muscles excrete or expulse a lot of carbon dioxide. This carbon dioxide is going to enter the blood, right? So the amount of carbon dioxide in the blood is going to rise, it is going to increase. This carbon dioxide mixes up in the blood, and when it comes in contact with the water, it forms the carbonic acid. So when H2O mixes with the water, it forms the carbonic acid, which further dissociates with H plus and HCO3, that is the bicarbonate. Okay, I am here comes your Bohr effect and everything, but I am restricting myself to the carbon dioxide itself. So there are two things which have happened. First, carbon dioxide volume quantity in the blood has increased, and secondly, the H plus ions have also increased. We know that concentration of H plus ions is responsible for maintaining the pH of the blood. So now two things have happened here. Firstly, carbon dioxide levels are increased and there is a pH imbalance also. Okay, this is the imbalance that has happened. Now, in the image on the right side, we see there is aorta and the carotid. There are sensory receptors located and pointed out as those yellow dots in the carotid and the aortic arch, which sense these chemical imbalance. These are the peripheral receptors, and centrally also they are located near the medulla oblongata, termed as the chemoreceptors, since they deal with this chemical imbalance of your blood. Okay, I've told you periphery, they're located in the aorta and the carotid artery, whereas in the medulla, it is located here around the medulla, the central chemoreceptors. These central chemoreceptors are more concerned towards imbalances in the CSF, the cerebrospinal fluid. Right? So when these peripheral chemoreceptors get these sense this imbalance in the carbon dioxide and the H plus ions, they send impulses from the vagus nerve to your pneumotaxic center to inhibit these dorsal respiratory group faster. So that switching off of the dorsal respiratory group is faster now. Eventually, it is going to, the diaphragm is going to contract, relax, contract, relax. Thus, the rate of breathing, respiration is going to increase. Okay. Along with rate, since it is switching off faster, it is tend to increase the process of exhalation also. So the depth of respiration is increasing along with the rate of respiration. Eventually, see the switching off and off, on and off is getting faster. Eventually, rate is going to increase, The oxygen is going to increase to the muscle, which was the whole need of the muscle, right? Increase in rate of respiration along with the depth is going to supply more and more amount of oxygen to the muscle, which was the demand of the muscle, right? And more the oxygen, more will be the expulsion of the carbon dioxide. Thus, the imbalance is getting solved. Okay, so eventually, whatever the need of the muscle was is being met with the help of chemoreceptors. So here we understand that these chemoreceptors are one of the major gatekeepers of your respiratory system. Any imbalance is coming in the pH or in the carbon dioxide is going to modulate your respiratory action. Okay, so here take a note of two important terms. I spoke about chemoreceptors, and secondly, I also spoke about the importance of vagus nerve, which is going to carry these sensations from the periphery to the neural center. Okay, this was about the involuntary respiration. Now, since we are speaking about respiration, I'll also take you to pulmonary stretch receptors. The name itself suggests that they are located in your lungs. They are stretch receptors, which means that they are mechanoreceptors. They are going to sense any mechanical, the pressure changes in the lungs. These pulmonary stretch receptors are located in the smooth muscles of your lungs. So bronchioles, bronchi, alveoli, the airways, trachea, these stretch receptors are located here. Whenever there is overinflation of the lung, these pulmonary stretch receptors again get activated and send impulses from the vagus nerve to your pneumotaxic center in order to inhibit the dorsal respiratory group. So what is your pneumotaxic center going to do? It is going to inhibit the DRG and prolong exhalation. The 3 to 5 seconds reference that I gave you, it is going to prolong that and inhibit, switch off the DRG faster. Switch off the DRG frequently, not faster, but frequently. So first thing, what is we have achieved is that the DRG is inhibited. So rate of respiration is going to reduce, first thing. And secondly, the process of exhalation is going to increase. Mind you, we said that the lung is overinflated. We don't want more and more amount of respiration, more and more amount of air entering and causing trauma to the lung. So that is being taken care of by reducing the respiratory drive. And secondly, by elongating or by increasing the process of exhalation, it is going to help exhale more and more amount of air, thus help you in reducing the overinflation of the lung. Okay. So this was about your pulmonary stretch receptors. We spoke about two things here. First, the chemical imbalance that is happening with the help of chemoreceptors. And we also spoke about the mechanical difficulties that are coming to the lung, which is overinflation, particularly seen in certain respiratory conditions like COPD. Okay. So when these pulmonary stretch receptors and chemoreceptors are working optimally, your respiratory system can modulate according to the physiological needs of the patient. Fine. So this we finish with neural control of respiration. Now let us move a bit forward. Let us move a bit forward towards the autonomic nervous system. Okay. So we know that the autonomic nervous system is the autopilot. It's a master to regulating all your involuntary functions in the body through two of the most important branches, the sympathetic and the parasympathetic nervous system. We know that the sympathetic nervous system activates or makes your body ready for action, right? In a situation of panic, in a situation of anxiety, in a situation of emergency. Whereas the parasympathetic nervous system gets your body ready or calms your body down, more pushes your body towards recovery and resilience. Okay. It is said that a balance of sympathetic and parasympathetic nervous system is extremely important for the optimum and vital functioning of our body. But when these two are in an imbalance, rather when one is working more than the other, and especially it is the sympathetic nervous system acting more, overactive sympathetic nervous system and hypoactivation of parasympathetic nervous system is the base for a lot many medical conditions, chronic illnesses, stress, oncology, hyperventilation, respiratory syndromes, everything is related to an imbalance between this sympathetic and parasympathetic nervous system. It stands as a basis for a lot many chemical conditions and medical conditions.